The year is 1994. I'm 14, giving away my age anyway. And I am a hemophiliac, which probably most people in the room would know, but if you don't, hey, that is a bleeding disorder, which means that my blood doesn't clot, doesn't coagulate properly. So as you can probably imagine, that requires people like myself and people with bleeding disorders in general need a lot of blood transfusions, blood product. And as has been mentioned a few times by the wonderful guest speakers here today, you've got that cutoff of the early 90s. And before that, it's a bit of a Wild West situation. You know, the kind of background trivia is I don't think there was a proper actual diagnosis designation for hepatitis C until 1974, 76, something like that, long before I was born. And back then it was called non-Hep AB. So look, I've done a lot of lived experience talks, as you know, implied by my self-written bio, but it's tricky to know what angle to go down, and it's been interesting having the opportunity to talk to everyone here today and to do the lived experience talk as kind of the end bracket of the day. And if we're a little bit cynical about this, I know, because that's usually the thing that tends to interest people. But when lived experience talks, I've seen a lot of lived experience talks done in different arenas, in mental health and other medical situations, and there can be an element of tokenism that tends to be introduced. Like we'll have the person giving their horrible, traumatic story at the start of the day, which is going to inform everything else, but hopefully, you know, also open up people's ears. But I think what is interesting is to have the information you've heard today kind of inform my story, so I don't have to go over certain details. But so I don't really have a horrible traumatic story that I want to tell you today. I do want to talk about, and really kind of going off the last presentation, about the difficulty in how the diagnosis was disclosed to me. It wasn't a disclosure. Well, I've since had to make the disclosure, of course, to people, but yeah, so it's 1994. I'm 14 years old. I'm a hemophiliac in the Haemophilia Clinic, of which is exactly one in the state of Victoria. I'm sorry to throw the Alfred Haemophilia Clinic under the bus to an extent, but look, I still go there for treatment. But there was a psychologist or possibly a social worker. I was there with my mother because I'm still at the age I need a parent or guardian there for treatment. And they tended to be nicer to you if you were there with your mum. We were taken into a room and I was told that sometime in the last 5 or so years, you have contracted hepatitis C. And the thing about 14-year-olds or even 42-year-olds and men and boys is we always try and act like we know exactly what people are talking about and what's going on at all times. And we don't like to ask dumb questions that kind of, yeah, I understand. So I left that appointment actually not knowing anything. And maybe even a little bit less about hepatitis C than when I'd gone in, because I was so set on just taking it like a man and kind of really, you know, show acting that I understood this thing. But the fact is, even from the way that was phrased, I left that appointment not really having any specifics. I didn't even understand from the way that was phrased by the social worker that I had Hep C. You know, it's sometime in the last 5 years you crossed the road. Sometime in the last 5 years you went overseas. Okay, but and I mean, it was years later. Like I think I was maybe 16, 17 when I actually had another conversation with my mum, and she had to tell me, no, you have hepatitis C. Now, it's really encouraging these days to see that we've kind of scrubbed out from the lexicon of terminology this idea of carriers and healthy carriers. And, you know, I know some of those kind of flowcharts we can get into, particularly when we're talking about hepatitis B these days. But it's a real, it was a real problem. I think, certainly in retrospect, that I wasn't given a full understanding of what was actually going on with my liver, let alone the fact of, bloodborne virus transmission pathways, how you can and cannot transmit it. It was really nice here to see during Chloe's presentation, everyone not raising their hands for, mosquitoes and hand holding in toilets, and I forget what the other 4 or 5 are. But I didn't have that. I mean, and I don't just mean at the time, I mean, I didn't have that into my 20s. And so the hemophilia clinic had obviously been part of the blood banks backtracking program to try and identify, individuals who had accidentally been infected with, I shouldn't use the infected word, that's a bad stigma word, but had hepatitis C transmitted to them. Yeah, I have to say that between that diagnosis at the age 14 and going into the hemophilia clinic at that point pretty regularly for some knee issues, and hemophiliacs generally have very bad joints, myself included. So I was going in a lot for treatments for joint bleeds and things like that, and it was only that there was a visiting hematologist. I went in when I was 25, so at this point that's 11 years. 11 years of living with this virus, for which I was told there is no treatment, there is no, and I mean treatment in the broader sense of medication, plans, anything like that. It was just, just try and avoid drinking alcohol, which is a great thing to tell a teenager growing up in Dandenong. But it did work, actually. I actually didn't dabble that much in alcohol. But anyway, the thing is, yeah, there was a visiting hematologist, not my usual doctor, who was seeing me. And he just happened to ask, when was the last time you had a liver ultrasound? To which I said, I don't need an ultrasound, I'm not pregnant. And so it was only just kind of by blind, like I would say basically by accident, that I had a doctor who kind of took more than just the perfunctory interest in what I was there for. And I don't know if the term holistic was used as much back 17, 18 years ago, but there it was. There was someone who took a wider view. And so we went down that pathway of, I got the FibroScan or the ultrasound or whatever it was at the time. And yeah, it turned out after 11 years of living with it and not really having any kind of care plan about it, my liver was starting to show early signs of, I guess, fibrosis, and it was determined that I needed treatment. Now, medication back then was interferon, which is the I word. That was still brand new. I mean, like 3 or 4 years, there'd been an information night for hemophiliacs at the Alfred. But this thing could not have been given the worst sell ever. I mean, as far as trying to selling it to people, it was just like we're not going to give you this stuff until your liver's about to turn into a pickle. It has a very low success rate. The list of side effects is literally as long as your arm. And so I'd left that session thinking, well, but I don't need that. But going to 2005. It was determined that I finally did need that. And so I entered the process of going on interferon. And me and my partner at the time were given probably the longest interrogation I've ever had, and I have been arrested before. And I had been arrested at that point too. About all the things you can and cannot and will not have, and now, or have you ever been blah blah blah. As far as the difficulty of screening to get on that treatment, because of course there was no discussion about harm minimization with the old interferon treatments, because it just wouldn't tolerate any other chemical interactions whatsoever. So I went on interferon for 6 months. I was 25, nearly 26 when I finished it. And it had a very horrible cumulative effect. Look, it started out just fine, but by the end of it, I was a complete mental wreck, to be honest. But the end of it came and it had actually worked. I mean, I think that it must have been monthly blood tests, whatever the regime was. But by the first one, I guess the first month out of the 6, they'd already told me that I was PCR negative, and that meant that the virus was undetectable. So that was kind of it for me. I finished my 6 months, and the only reason I'm talking to you here today is in the intervening 11 years from 2005 onwards. Interferon was the only game in town. 2016 rolls around and there's no treatments available. Now, I can tell you that in those years, I very, very much wanted to put my hepatitis C treatment behind me. It had been a nasty experience. It had been embarrassing and debilitating around my friends, because I really wasn't telling anybody why I had, disappeared from social events and all that stigma stuff. Very much internalized. But when I found out that these new, I still call them new treatments, even though we're 6 years into the DAA being available, but yeah, I really feel like this story, it doesn't have value in terms of me telling you all the ins and outs of how bad interferon was, but only to give context to just how miraculous the treatments are. And look, even in the time where I was working at Liverwell, just in those couple of years, I mean, that the chart of the types of medications, the types of DAAs available radically changed and got easier and easier. And there were certain genotypes that had to be, you had to play the mix and match game. And most of the treatments now, you don't, they work for all genotypes. So look, it's amazing the progress that's been made. I've been guilty in the past in my lived experience talks of playing a bit coy about which information I do and don't give out, which I think also speaks to your previous presentation, Adrian, about seeing the whole person. And there are, in certain contexts, I really like to kind of play that last card about, well, guess what? I didn't get Hep C through intravenous drug use. But at the time that I had taken interferon treatment, I wasn't yet working in the harm minimization space. And I used to tell this story or tell a story of the sort of, well, I called it before, speaking to someone earlier, my kind of road to Damascus, falling off the mule of like, oh, I realize how badly these people are treated. We've seen in the last year just how appalling that kind of, I went home and I talked to Jenny last night, and that could have been me and what you're like. So I don't feel like that particular story has any use for you, for anyone listening to this. I mean, yes, I didn't appreciate just how present and real stigma and discrimination against a perceived demographic of people can be. I've since experienced it, even working professionally as a community support, as a social worker. When I began working at Hepatitis Victoria, I mentioned to a colleague that I'd started that work, and just in a lunchroom conversation, that person very loudly declared that, oh, I'd never tell anybody if I had Hep C. I imagine that. And this person, not only at the time were they a family support worker, they actually went on to be my supervisor later on. So I really wish I'd made more of a fuss about it at the time. But we sometimes instinctually just downplay things to get through. So yeah, forgive me, I've gone a little bit hopscotching around different topics today in terms of my experience and the general experience of hepatitis C treatment. I'm going to leave you to take what points you would like from that. I don't need to tell anyone here before you came here today that stigma is real, that the easy to reach cohort of hepatitis C carrying population have been reached. I don't need to tell you that it's not just people who have injected drugs have Hep C. You're looking at one who doesn't fit that description, but you also don't need me to tell you that people who have injected drugs need the same level of care as the rest of us. I really appreciated Dr. Wade's presentation, where she had the screen listing of here's everyone who's a susceptible cohort, and just stand with a big, you know what, just treat everyone. So that's my story. Treat everyone the same, except when you can't. Treat everyone equitably, not with equal access and equal care. But look, if you're here, if you're listening to this, you obviously have some interest. So thank you for listening to me, and just thank you for the work you're doing, and thank you for your interest in this topic. I'm like way over time, aren't I? Okay. I would like to just invite, if there's any questions you'd like to ask, happy to. Oh, but I've got the mic.
Firstly, Stephen, thank you so much for your very insightful presentation and for sharing your personal story. I mean, it's a big thing to get up in front of a bunch of people and do that. What would you tell your 14-year-old self?
Thank you, Chloe, and thank you. That is a really good question. Like, yeah, ask more questions. The risk of embarrassment versus the risk of leaving that room without some critical information you need about how you're going to interact with people as a teenager and onto your adult life. Yeah, ask more questions. Don't be afraid to shake the proverbial tree trunk. And I mean, that's kind of what inspired me to go on and become a social worker and community advocate myself. Thank you.
Cheers, Stephen. That was really great to hear. I don't really so much have a direct question. I'm going to be one of those comment people, but I really liked the way you discussed the interferon stuff, because I think that there's this urge at the moment to just sort of push interferon into the past. It was terrible. The new treatments are really good, and we can just forget about interferon now. And I think, like your story says, that so much of the meaning of the new treatment, why they're as significant as they are, and the cultural narratives of them are actually co-made, like they're mingled with experiences and this history of interferon. And, a lot of the people that we've spoken to, and, they still talk about interferon, even people who haven't had it, they just talk about people they knew and all that kind of thing. And I think just kind of remembering that, medical, like your story really speaks to me about, like medical breakthroughs and stuff happen on the back of all of these experiences of people who, for many times, were less than ideal. And I think that just really speaks to the significance of like remembering those and their contribution.
Yeah, no, thank you. And I mean, living aside the lived experience hat for a second, as a health promotion officer, some of us have done health promotion sessions in prisons where, I mean, I've got direct, data on this, where people will dismiss your presentation on treatment because they're still confused. It's like, oh no, I've my uncle, my brother, or I've tried that before. I'm not going near that interferon shit again. So there's still a cultural memory, and yeah, frankly, trauma around that use. So yeah, that's a really good point. As practitioners, we can say, oh no, that's fine now. But as with many other, demographics of traumatized people, it's all well and good to say, oh well, now it's fine. Let's forget about the past. But that doesn't work for most of those people. Anything else? Anyone else? Okay. Oh, we've got one more.
Mine's not really a question, Stephen, but to me, what your talk illustrated a lot of things, but one of the things that it illustrated for me was the value in kind of systematic approaches, and I think universal screening would be fantastic for hepatitis B and C. And your experience as a 14-year-old, it just kind of illustrated how hit and miss things can be, and the sort of response that people might have. And had it not been for the specialist, the other specialist that you saw further down the track, then who knows? It just. I
mean, it could look. I don't want to, go into hyperbole too much, but it is in some way, at least some ways, an accident that I ever got treatment. And look, I was at the stage, I don't know if my story fully illustrated this, but there has been the question of, well, why didn't you just wait for the DAAs? I mean, we were sitting here listening to the doctor this morning saying about, 10, 20 years, we'll have that Hep B cure. I mean, you don't know that at the time. So I had to have interferon, or again, not to be too dramatic about it, but I might not have made it to 2016.
Yeah. When someone's already lived with something for a few years and there's damage taking place, then you've got to do something.
Absolutely.
Thank you very much.
So thanks everybody for listening.